Okay, so why don't we get started in the interest of time? So good morning. Welcome to ICS's Research Forum 2022. My name is Rosario, Cartagena, and I'm ICS's Chief Privacy and Legal Officer, and I'm also the moderator for this morning's workshop entitled How Health Data Research Network Canada, or HDR Canada, is addressing challenges to pan-Canadian research. Our panelists this morning, so next slide, Nicole, include Juliana Wu, who's the Manager of Decision Support Services and Corporate Data Request Program at CanPath. She's also the lead for HDR Canada Data Access Support Hub, otherwise known as DASH. Juliana has over 18 years of analytic lead and managerial experience at CanPath. Our second speaker is Donna Maillet, who's been the Privacy Officer at the New Brunswick Institute for Research Data and Training since it originated in 2015. She also serves as the lead for HDR Canada Privacy Team. Donna holds an interdisciplinary PhD with research work experience in science and technology studies and legal pluralism. In addition to serving on a variety of data access and research ethics committees, Donna is a part-time lecturer in sociology and public policy at St. Thomas University. Our third speaker for this morning is Nicole Yada, who's the Manager for Partnerships for HDR Canada based at ICS. Prior to joining ICS, Nicole managed health system partnerships at Ontario Health and also worked at Trillium Health Partners. Nicole holds a master's degree in e-health from McMaster University and is completing her PhD in health services research at the University of Toronto. So welcome to our panelists, and thank you for participating in this morning's workshop. So moving forward to the agenda for the workshop this morning. So the way in which we've organized the workshop is we will first begin by providing an overview of HDR in Canada, about the Data Access Support Hub, our approach, the alignment and the work with the committees, as well as dive deep into two different case studies and an opportunity for discussion. I should add that as the moderator, I have questions prepared that I will ask our speakers, but I really invite all participants to ask questions throughout. I will be keeping check on the chat, and I will be prompting and asking the speakers. So we really hope that this is a very interactive workshop. We invite you to ask many questions, and if we don't know the answers to the questions, then we will certainly take note of them and come back to you. So without further ado, why don't we first begin? Nicole will provide an overview of HDR in Canada.
Terrific, thanks so much, Rosario. So Health Data Research Network Canada was incorporated as a not-for-profit corporation in 2020 and connects individuals and organizations across the country to share expertise, identify opportunities for collaboration, and foster innovation in ways that respect public expectations and Indigenous data sovereignty. We had recently just launched our new strategic plan, which includes our vision, which is to drive, data across Canada that drives improvements in health and health equity. And our mission is to bring together people and organizations across Canada for transformative and world-leading health data use. So as shown on the slide here, HDR in Canada is comprised of provincial, territorial, and pan-Canadian organizations with decades of managing health data. And we each bring with us our established relationships, including with many of yourselves here today, that complement the network. And so that includes provincial data holding organizations and ministries of health. ICS is a founding member of the network and has been involved since around 2015, when data centers began working together more informally as the Pan-Canadian Health Data Research, Pan-Canadian Real World Health Data Research, Pan-Canadian Real World Health Data Network, I believe. There's a reason we changed our name, clearly. Okay. So HDR in Canada is supported by CIHR's Strategy for Patient-Oriented Research, or SPOR, and by federal, provincial, and territorial partners, and received a sizable grant in 2018 to develop the SPOR Canadian Data Platform. The objectives outlined here today closely map to the various working groups and teams across our network, two of which will be speaking here later today. So the grant objectives listed on the previous slide make this all look much simpler than it actually is. So the data environment is complex and complementary, and we know that no single organization or network holds all of the data that researchers are interested in. We know that researchers would often like data from multiple jurisdictions to be pooled in one central location, but this is not always feasible. And so like the Gordian knot here, innovative approaches are needed.
So Nicole, I have a question for you before turning it over to Juliana, who will discuss and provide an overview of the Dash. How does HDR in Canada work with the private sector?
That's a great question and also quite a complex one. So our priority currently is supporting publicly funded research projects. However, one of our network's guiding principles is having respect for local policies and processes. And so members of our network, including ICS, have established processes for working with industry, and those can absolutely be leveraged to support studies with other interested provinces. Going forward, supporting private sector funded requests is of interest so that we can maximize the impact of data health held by HDR in Canada's data centers.
And just to follow up on that particular point of working with the private sector, would you say that between HDR and Canada, the different institutes have similarities in how they approach working with the private sector, or is it different depending on which province the institution is located?
It's very different, and have worked closely with Juliana on actually mapping those differences out across the provinces and working together on developing where we can actually harmonize some of those policies across provinces just to make it a little bit easier for the client experience. But yes, there's substantial variation that exists.
I see. And would you have a better understanding of why there exists those differences across? Is it just by virtue of the different laws that are in place, or the expectations from the provincial citizens in terms of how the institutes work with the private sector?
So I would say it's probably a combination of all of the above. There's expectations of the public that the different data centers serve. There's also the funders that are involved, and those may have different expectations or ways that they support or do not support working with the private sector. And in between, there's also just a variety of different perspectives on whether studies should be academically led versus industry led. So yes, there's no one size fits all answer for the rationale for why that variation exists. So yes.
Terrific. Thank you very much. Perhaps an opportunity for improvement as well when it comes to working with the private sector. Excellent. Okay, so let's move it along to Juliana, who will talk to everyone about Dash.
Thank you, Rosario. Good morning, everyone. So yeah, really excited to talk about the Data Access Support Hub, or the Dash, with this group. Of course, Dash is kind of the first service that was launched from HDR in Canada back in February 2020. So we think about Dash as a lot of things. It's website, it's people, it's resources. But I think to get started is that we are a team of people. It's a team of multi-center representatives. We have representatives from across all our 13 data centers in providing Dash services. And I think first off, we want to clarify that we don't hold data. Like Nicole mentioned, we really rely on the data centers that are participating in Dash to hold the data assets and provide access to the data. What Dash does, though, is to help researchers through that very complicated process. So we see ourselves as a couple of different areas of value add. First off, and I'll go into this a little bit in detail the next slide, is first off is to just provide navigational support. There's a lot of resources, there's a lot of policies and legislations that look very different across each of our jurisdictions. So part of Dash goal is to help researchers such as yourself to navigate through that and really bring some clarity and transparency around the policy and legislative requirements around data access across all our jurisdictions. Secondly, is we want to support researchers if people are actually interested in providing in accessing the data. So if there is an interest to actually access data from each of our data centers, then we have our team actually have a process to support you throughout that journey from the point of intake all the way to data provision and data analytics. And then, of course, over time, as our team work together, we also really ideally like to see that our processes across the centers be a little bit more harmonized. To get started, we need to do some foundational work around documenting our existing processes, having very good, solid standard operating procedures across our centers so that we can work closely as a team and provide the best service available to the researchers. And over time, ideally, we like to see process aligned across our centers, areas of them being able to be aligned as well as automated. So that's broadly the goals for the Dash. Next slide, please. So yeah, I think first off is to just reference all the resources that we have available through Dash. For those of you who have not seen our Dash website, I really invite you to go there. There's a lot of information that's available, even just to browse and get to know a little bit about all the data assets that are available across the country. So there's multiple inventories around our data assets and procedures on our Dash website. Like I mentioned, in the inventory for data assets, we have over 500 assets that are available for you to search and take a look at, and just to get a sense of what's available and what's feasible out there. As well, we have an inventory of many algorithms that's been validated or feasibility studies done for multi-jurisdictional work. So again, it's a wealth of resource just for people just to take a quick look and see what can you leverage if you're just getting started on designing your study. As well, there's a couple pieces of information and reference material on the website that can help researchers start thinking about their study design. There's many things that we would really recommend people to start thinking about before you go deep into your study design and your study protocol. So things such as consent, such as linkages, such as pooling of data, which we'll get into later on in our case studies as well. But all that to say, there's a lot of things that we can invite you to actually browse on our website. And with COVID-19 in the recent years, of course, we also have a dedicated area within our website that showcase the data that's available and what each of our data centers have been doing around the COVID-19 analysis and information that's available. Next slide, please. So like I mentioned, like if you're a researcher and you browse our resources and you're very interested in proceeding with a data access request, we have now formulated a single coordinated path to support you through that journey. So prior to Dash being available, what you may have to do as a researcher interested in doing multi-jurisdictional work is you have to go to each of those centers that you're interested in and knock on their doors and figure out what forms to complete and figure out what requirements, approvals, ethics that you would require. With Dash, what you can do is just come to Dash, one door through Dash, and we can walk you through that process. So this is just a quick kind of high level description of what our process looked like. So from the point when you provide an intake information to us, we will take it in. We will work with our data centers behind the scenes to look at what you're looking for, determine eligibility and feasibility. If you need a confirmation feasibility or letter of support or cost estimates, we're happy to provide that to you in that early stage as well. And then once you have all that information provided to you and decide to proceed with a data access request, then we can support you through that journey as well. Now, recognizing that starting around that stage 2, the data access request, it does vary by jurisdiction because every jurisdiction has its own requirements and in terms of reviews and approvals, but we can help you through that process. And then all the way we'll take you through to data release and monitoring. So at that point, we can provide data to you either in kind of the more line level way, so that you can access the data files through our trusted environments for the centers that have those trusted analytical environments, or we can also provide you with analytical outputs if that's what you're looking for. So it's certainly a kind of end-to-end process that we hope to provide support for. In terms of the timelines there, these are some of our target timelines. We really want to, and I think we're finessing our process so that early stage of intake, we can get it done quite quickly for you. And our target is about 4 to 5 weeks to turn that around to you all the way through to confirmation of costs and feasibility. As we get to the data access request stage, you'll see it's a huge kind of time frame, and that's really just to acknowledge the fact that these are still very much locally driven process. So it's very tough for us to be very specific about timeline, but the intention there is, of course, to help push through those processes with you as quickly as we can. Next slide, please. So this slide, just to share a little bit with you, some of the support and requests that we have worked on to date. So we have about 80 intakes so far since our launch. There's two various types of study there, as you can see. And I think if you look at the status of these requests, like we do a variety of things, right? So many of these data requests are in the process of getting data prepared and provided with the end goal of data provisioning and data analytics. But at the same time, we also support these projects by redirecting them at times, sometimes redirecting to a different center or thinking about it in a different way, maybe the more cost-efficient way of doing things. So we'll advise on those type of things as well. And sometimes requesters get all the information that they need and determine that, well, maybe it's not the right timing, or they don't have the funding right now. So, and that's all right, because we will, we provided the support, and when the researchers are ready to proceed, they're always welcome to come back to us and work with us. So this, our support certainly looks different. It's broader than just data provision. I would say the navigational support is something that people had really been interested in, and also building relationships, especially for researchers earlier in their career and not knowing where to go. Dash is a great place for us to help support you building those new relationships that can be worthwhile for the rest of your career.
Juliana,
yes?
Sorry, I have a quick question for you. Is Dash able to facilitate access to data from Quebec?
Yes, so this is a great question, and then you'll see in the chart. In the chart, it does indicate for you, at point of intake, which centers people have indicated interested, and you'll see that people, broadly speaking, come to us wanting data from all parts of the country, including Quebec. And I'm happy to share that, just in the recent months, we have formalized a relationship with the Statistical Institute in Quebec, ISQ, and we're starting to work with them to look at process and provisioning of Quebec data. We have 1 or 2 requests right now that is actively pursuing Quebec data. So I think that possibility is certainly opened up now, and we'll finesse our process as we go. And you'll see from that chart as well, like Statistics Canada and CIHI, these are the pan-Canadian organizations, and they definitely service different needs. These organizations are pan-Canadian, so they do have pan-Canadian data resources in place. And so we can certainly make those connections and provide that support as well. Thank you, Rosario, for that question. And I think that's what I intend to share. Definitely want to be part of the, provide more information and participate in the case study discussion afterwards.
Juliana, I have one more question before we turn it over to Donna. Does all the data that's being accessed via Dash require a Research Ethics Board approval?
Yes, so broadly speaking, yes. I think all of our data centers at the moment do require ethics review and approval. And that's actually a great question, because on our Dash website, we do have a page that lists for you by jurisdiction what is required for research studies. So is ethics required, is local PI or local ethics requirement as well. So there's those resources that are available on the Dash website for you to take a glance at, and certainly send a note to Dash at hdrn.ca for questions.
Great, thank you very much, Juliana. Okay, so let's turn it over to Donna, who will provide an overview of our approach.
Thanks, Rosario. So really, to facilitate the collaboration and problem solving across the network, and particularly when we're looking to address a multi-regional research work, the approach that we've adopted is to bring together a group of groups, really, to have people addressing all the different areas. So when Juliana was speaking, she was talking about these inventories and the modeling, and everything works together. And so we have a set of working groups or teams, and right here is listed, algorithms and harmonize the data working group, the Dash working group, which Juliana is the chair. We have modeling and informatics, inclusivity, diversity, equity, and accessibility, or our IDEA team, Indigenous data team, and this team is speaking to this data sovereignty, the importance in our research work and our data collection throughout all, even as a network. Partnership team, which is led by Nicole, the privacy team, which I am fortunate to be able to lead, and the Public Advisory Council and Public Engagement Working Group. And you can see there's a real diversity. And even while we're all have our own terms of reference and our specific goals and things that we're trying to accomplish, we do work together really collectively to for the greater vision of the network. Next slide. Oh, sorry, next slide. So, and I called what I I'm speaking to here is what I'm calling harmonization by design. And I've taken this completely from the privacy world, because for privacy compliance, often the model that is adopted is to build privacy into all steps of our interaction with data. And we call that privacy by design. And it just means that from the get-go, that privacy is embedded in all of your interactions with the data and safeguarding the data. But the network, what we're doing is we're building harmonization into what we do. And so in the short term, that means together we can assist each other to navigate really common challenges that we're facing right now. And we can share our experiences, and we can learn from each other, and which has been an amazing, especially as we have new institutes that are coming on board with HDR in Canada. And like some of us are in, like today you're celebrating 30 years, that's amazing, you know, and some of us haven't even opened our doors yet. So this is a great way for the network to work together. And then we have these midterm solutions where we're establishing harmonized practices now that are going to help us build into the long term, so that common data access practices and experiences will be available to researchers as they do multi-regional research work, so that when you're putting together maybe 3 or 4 provinces or territories together in a study, that you're not having to do everything completely different in each region. And that's part of the way of harmonizing our practices. So, and by way of example, I just wanted, because I know the privacy team, I'll just give you an example of some of the things that the privacy team has been able to accomplish. And the first, of course, Juliana mentioned the diversity in legislation across. So on the website, there is a page you can go to that lists all the provincial and territorial legislation, and particularly obviously in reference to research, secondary use of administrative data, and you can click on, is consent needed? You know, which provinces include consent in their legislation. Disclaimer, it is not legal advice. It is a starting point for understanding legislation. We've also put together a guidelines for informed consent wording around for administrative data linking. And this could be if you are looking to link, perhaps you're doing some clinical work and you want to link administrative data, or maybe you're building a data set, that consent piece is needed from your participants. And advice, we really were finding as privacy officers that advice was needed around these guidelines. And I'm really proud of this piece of work that we were able to put. It's available on the DASH website. And why I'm so proud of it is we workshopped it across the country. Often as privacy officers, we are the only person doing privacy work in our institutes. And so this team of folks across Canada were able to work together. And then we reached out to our local networks. And so we have colleagues who reached out to their REB boards, shared this document with them. And we got feedback beyond just the HDRN network, which means that hopefully these guidelines are really more acceptable to most folks. So, and then other work that we're working on right now is data sharing agreements checklists, which might seem, what is that all about? But to share data, we have to enter into data sharing agreements. And of course, each region has their own unique preferences. So how can we streamline that process? We're working with a checklist. And then another issue that keeps coming up, a common shared inquiry, is guidelines for balancing between privacy compliance and REB requirements. As a researcher, which comes first, or how do they balance out? So we're working on development right now for guidelines there. I wasn't going to say very much, I guess.
So Donna, so as you know, privacy law is near and dear to my heart. So with the privacy team, so certainly there's a lot of work happening in relation to existing practices and processes. Is there any work that's happening in terms of future looking, or is there a more expanded role do you see for thought leadership in the privacy space to advance some of these thorny issues and challenges that we seem to always be struggling with, such as, privacy principles applied to artificial intelligence and research, for example?
Yes, yeah. Actually, that is very much at the core of the data privacy, or the privacy team. What we want to do as a group of professionals is we know we understand, we're listening to the researchers, seeking to access this data, and the status quo is not working for them. And we understand that, but also as privacy professionals, we're very mindful of the privacy, compliance, and safeguards and responsibilities. So we are looking for solutions outside of the box. We are looking to address problems hands-on, like really trying to get involved where we can. Can we speak to legislation? Can we anywhere that we can participate? Just a brief example, last year when the Tri-Council had some decisions coming out on multi-regional REB review, we made sure that we participated collectively in that and shared our experiences there. So yes, we really do want to affect change, but in a mindful and privacy compliant way. So, yes.
Great. Thank you very
Rosario.
much. Thank you, Donna. Okay, so now we've now provided you with a background and overview of HDRN Canada, of DASH, as well as alignment between HDRN Canada, DASH, and the committees and the working groups. So now we're going to dive into the case studies, and Nicole is going to come back and provide an overview and introduction to the cases, and then we'll start to dive into the challenges that we have faced and perhaps brainstorm solutions with all of you together on this workshop. Thank you.
Thanks so much, Rosario. So we know, and largely since launching the Data Access Support Hub, that researchers are looking for more than the status quo in Pan-Canadian research. So in some cases, the data already exist and are held by other organizations and could be enhanced by linking to health admin data. In other cases, there's actually an opportunity to incorporate the ability to link data from the outset of ability to link administrative data from the outset of data collection. And that speaks to some of the tools that Donna had mentioned that her team has developed, including the guidelines for informed consent wording. So over the course of these cases, we're going to take you through the first two chunks here on the data life cycle. And these are ones that have required extensive coordination and collaboration. The conference organizer had asked us at the outset of today's panel whether we knew each other, and do we ever? It has required a ton of coordination and teamwork to actually bring these to light. And I'm delighted to work with Donna and Juliana here on tackling these together. So as I had mentioned on an earlier slide, no one organization or network holds all of the data that researchers are interested in. And so one way that HDRN is addressing this is through the development of the Canada Health Data Research, or HDR Alliance, to enable researcher access to data that accommodates this complex data landscape. And we're very excited that the first pilot members of this HDR Alliance were the Canadian Partnership for Tomorrow's Health, or CanPath, and the Canadian Longitudinal Study on Aging. So as just mentioned, so CanPath was the first member of our HDR Alliance. It is the largest population cohort that exists in Canada with over 330,000 participants across, I believe now, 7 different regional cohorts. Some of the collaborative activities that we're working on together with this partner are coordinating a CanPath pilot project through the Data Access Support Hub, and we'll be going over that in a bit more detail throughout the cases. We're also facilitating linkage with regional cohorts and HDRN Canada data centers were not currently existing, and that's something Donna's team has taken on, and it's fantastic to see that happen. And then also identifying and documenting joint intake workflow, feasibility review activities, and timing. And this speaks to some of the harmonization efforts that Donna had mentioned earlier. Our second case is about advancing data sharing. And so we're very fortunate to be working with a Pan-Canadian clinical trials network on a consent-based clinical trial that is taking place in over 50 hospitals across 7 different provinces in Canada. So this particular study is interested in pooling data centrally for analysis to inform clinical decision-making. It's actually a COVID-19 study, and they're interested in using admin data to understand long-term outcomes. From our administrative data centers, we selected one variable, and that's fact of death, as the kind of the lowest hanging fruit to test process for how data linkage and sharing could work for this particular study. And in parallel, we're doing a formal policy analysis following the project in real time across our different centers to document key activities, roadblocks, and enablers to share data sharing for secondary use in research. And we're really hoping that the learnings from this will inform HDRN and partners on barriers to data access and also provide leverage for change in policy and practice. Really important for how we're approaching this study is that we're testing processes for linking with admin data in a way that is repeatable and scalable. So we're using this one study as an example, but always keeping in mind whether this is something that could apply more broadly to other studies and trials. So we're going to start with the data collection aspect of the data lifecycle, and we're going to compare and contrast these two different case studies. So starting with CanPath that I had mentioned earlier, and I think have seen that we have members of CanPath in the audience here today, so thank you for joining. So CanPath is a consented cohort study that was established in 2008, and they have participant consent that allows for data linkage with our admin data centers. And this is crucial in order to be able to make this partnership happen. And so they had done a fantastic job at setting that groundwork underway so that it is easy for our centers to take this and be able to not only link with the data, but also support studies that are interested in using the data. For the particular study that we're supporting through this partnership, it's a COVID-19 study that is working in 3 different provinces. And originally there was an interest in data pooling so that the analysis could all be done in one place. This is very common for the multi-region studies that we encounter and that often come to the Data Access Support Hub, but is much more challenging in practice than it may appear.
So Nicole,
No, go ahead.
I was just going to say on that particular point that you just raised, why isn't data sharing allowable if there is consent or there is a DSA? Can you tell us a little bit more about what you discovered on that particular point?
So I can actually speak to that. So that's actually what I was going to jump in. So we're on the same wavelength. So consent is needed because it's the first reaction is when you're doing a multi-regional study, I believe from the researchers, is it makes sense to put the data all in one place. You know, it's you limited resources, limited time. It seems very like, you know, common sense. Let's put it all together, efficient, you know, kind of thing. But our current processes and relationships and types of agreements we have with our data business owners just do not allow for this kind of the ease of pooling. And I want to be really clear about this. One of the first things we did when it was very clear at the beginning and different requests were coming into Juliana's team, people want to pool data, people want to pool data. So we looked at all the legislation across Canada and at the different regions, and we couldn't find outright in the legislation where it says, no, you cannot share data across borders, which is what you would need to do to pool the data. But it certainly doesn't say how you can do it easily. And there are often many requirements and elements and safeguards in place. And patient consent is the most common piece across all the jurisdictions that consent to not only share the data, but to disclose it across the border and to pool it. This is the consent that's needed. And so it's really something that's difficult to navigate, and exactly why we are following this case all the way through to see where are the policy glitches, like why are things done the way they are? Why are they done in the order the way they are? How can we make it more streamlined and more more repeatable, something that can be repeated in a more efficient way? Did that answer your question, Rosario? Did I?
It did. And so then I just have a follow-up question. So if we go back to one of the earlier slides, it said that, you know, participants was upwards of over 300,000 participants. So if you can imagine, asking participants to reconsent if you're sharing data across borders would be a very Herculean task. It'd be very challenging. So what advice would you give to researchers who are thinking about, conducting a study, and they're putting together their consent form, and they think, the data might need to be collected from different provinces, but they don't know yet in terms of structuring that informed consent form correctly from the outset to ensure that there aren't these challenges that we see downstream?
The easy answer, I would say, is go to the guidelines. That's what they're there for. It's to help what language needs to be included, and they're not meant to be you must do it this way, but they're meant to be a guideline and to offer some language and the important pieces that need to be included. And do it early, do it right from the beginning.
Terrific. Thank you very much, Donna. And I think you are next to talk about, no, it is Juliana to talk about data use and access, I believe.
Sure, thanks, Rosario. So I'll get on. Yeah, exactly.
Oh, thank Juliana, sorry, before you begin, there is a question from the chat, and Donna, it says, did I hear correctly? The problem is that consents that have been drafted in policies developed by the provinces. So it's not, I think the question is getting at, it's not necessarily the law that is the challenge when it comes to these types of studies, but it is the consent form itself and provincial policies that are in place when it comes to data sharing. Is that right, Donna?
All excited, I'm not muted. So there's two elements to that. So yes, for sure, the consent forms are often just not explicit enough, where there's in things that we know now, that consent forms have to be informed. There can be no implied. We try to be as specific as possible. And then on the policy side, yes, it's a risk adverse. People don't want to be, even when consent has been provided and it's been done correctly, some jurisdictions or regions are just apprehensive, and the data business owners do not want the data centers sharing across borders. And some of the requirements are quite demanding, like must have permission from the minister. So that means you have to work with the province for any kind of, that is one of the examples in this particular case, is for the province of New Brunswick, we need to ask the minister's permission to share this one variable across the borders, even with a consent. So it's not easy. Yes, agreed. It's not the legislation, it's how we interpret it, how we use it.
How we use it. Thank you very much, Donna. Okay, Juliana, over to you.
Sure. So just, starting with the CanPath project. So there's a couple of things that jump out in that experience so far. I think one is, the very exciting, but also very daunting prospect of working with a different, an outside partner or a partner outside of HDR and Canada data centers. Because the idea here is that, well, not all of the CanPath data sits in our data centers per se. So we need to work with our CanPath partner, and we've been working very closely with them around mapping out the data flow and the process of bringing some of these cohort data into our data center so that it can be linked to our data center's data and then provided access to the researcher. But I mean, it's challenging to walk through all of those nitty-gritty details, but at the end of the day, it is also very helpful for us as we, because all of this learning and all these processes that are drawn up on this particular project would be useful for future projects and future collaboration on projects that involve CanPath data. So that's one thing, is that the importing and the bringing of data together from our CanPath partner and HDR in Canada. The other interesting piece also is, of course, recognizing that CanPath is a very well-established and respected cohort, has its own access review and approval requirements. So we need to make sure that that kind of a review at CanPath side also drives and aligned with our respective data centers review and approval process as well. So again, it's a little bit of mapping of timing and process and flow of approvals and requirements. But having said that, I think it's been a really exciting prospect. We just recently had a great meeting with CanPath partners, but also their regional cohorts as well. And everyone is, really on board to kind of just work through some of these lack of clarity, and we now, I think, have a very good picture of how things could go, and data can move, not just for this project, but for future projects as well. And then the other thing, of course, is there's also the prospect of new data sharing agreements. I think it's near and dear to Donna's heart. So in particular with our Atlantic Path partners, there's no existing data sharing agreements in place. So that's I guess a great area for us to chart the course and kind of get get things started in a way that can be very conducive to the partnership. But Donna, I don't know if you want to add to that piece, the data sharing agreement.
No, just that the advantage is that, so for Atlantic Path, there's 4 data centers across Atlantic provinces that want to receive that data. And so by working together, we were able to approach the data business owner and say, hey, all of us want this. So, let's put an agreement together and facilitate that, so they're not having to have conversations with all 4 centers individually. And then of course, the advantage is that, we use the same, the variable lists, we came up with a common access application. Those are kind of things that are all features that we can work together and harmonize. So
yeah, thanks for that.
And so Donna, a follow-up to that. So it seems to me, over the years, I've heard the Holy Grail being having a template data sharing agreement is the way forward. And, everyone seems to really want a data sharing template in place. Why is it that we just can't have a single DSA template for all the provinces in Canada?
Yeah, that's great. You're right, the Holy Grail. So not with CanPath, but with another group that we've been working with. I want to say we're very brave. And I said the privacy team are trying things. We did try this team was excellent. Nicole was on this group and really tried to facilitate. We really did try. We looked at common elements. What can we include? How can we come up with a shared template? But the reality is the regional requirements are so different, and between pieces, little bits of policy and how agreements are set together, and even our authority in our regions is different. We're not all custodians, so we all have, there's just too much variance. But what we've done instead, so we've harnessed the opportunity. We did identify common elements, and we did identify where things are different. And so we are building, and I alluded to this when I spoke about the privacy team's work, we are building well, for lack of a better term, a checklist, so that if you were looking to do data sharing as a potential partner and you had multiple provinces or regions you're working with, then you would know what is required in each one of those, so you can move things a little more smoothly.
Great. And do you think that this would be an area, thinking about the privacy team's role and thinking about thought leadership, that, potentially working with the federal privacy commissioner on, having a more harmonized data sharing agreement for research could be a possibility in the future at some point in time?
That would be amazing. Yeah, but you know what? I know that sounds, to me, like that just sounds so, but that's the kind of stuff that if we don't start trying now, we need to affect change. It has to start somewhere. So why not start with us? So.
Right. Great. Terrific. Thank you, Donna.
So I can just speak a little bit about the MultiCentre Trial and the application of the data use and access and what this has meant for this particular case study. So because as I had mentioned, that there's 7 different provinces involved in this trial, this has required completing 7 different data access request forms, all of which are not a one-pager and all collect similar but just different enough information. So that has been an extensive activity. And because we're trying to do something new here, and that's actually pool the one variable for centralized analysis, it has also required developing language and data flows for something that is not currently allowable or as part of our normal practice. So it's finding that balance between what how can we push for something that we want to happen and not get a hard no or scare people off. So this has been an excellent exercise in working with the different provinces, also working with the research team themselves, and a really, really iterative process to try and move the needle a bit here.
And maybe to jump in here, Nicole, just to follow on your point around the 7 different data request form, that is, we've heard that again and again, that is the pain point for multi-regional research, because it's really every data center at the moment has different paperwork and data access request forms that need to be filled up by the researcher. So on Dash side, we are working very hard to create, working towards a more centralized data request form. And part of that, one of the main component of that form is a data set assembly plan. So in this past couple months, what we were able to do is to develop a template whereby it's just a centralized template where, researcher would start with articulating what their data requirements are. So what do they need in terms of data, regardless of which jurisdiction they're thinking about. And then a Dash team would take that data requirement and then map it to their local descriptions and definitions and algorithms. And so that template has been very helpful in a sense that, one, everything's documented in one place. We don't have multiple papers and pieces of paper floating around in different data centers. Second is when we see everything all mapped out in one place, it's a great avenue for all the data centers to look across and say, hey, that's how you do it, that's how we do it. And are we really aligning in terms of our definitions? Because this is the first time that every center can look at it all at the same time, as well as the researchers can provide feedback on that. So that is the first piece of one of the bigger component of the data request form, because a lot of that data asset or data set creation plan information like data element selection and algorithm would then go into the centralized data access forms, so that the holy grail, again, is another holy grail, is that one document that the researcher eventually can use that could be submitted for review and approval across different centers. So just so you know that it's work in progress, but it's exciting for us to know that it's moving towards a little bit of a centralization.
That's terrific, Juliana, and I think that's very helpful for for the data centers and even some of the individuals working at the data centers to understand, because certainly I can only speak for ICS. Whenever we have disclosures for third-party research, we have to do a privacy impact assessment to confirm that disclosure is lawful and so forth, and that the requester meets all the requirements in our privacy, in our Personal Health Information Protection Act, and that there is an REB and so forth, a checklist. So to the extent that we can centralize that, I think it would go a long way to helping out the individuals who are tasked with reviewing these requests and processing them quicker. So that is definitely good news. Do you have a sense of when that's going to be launched?
So the DAP or the DAP or data set assembly plan, that template is already available and we're using it in our projects. At the centralized data request form, we anticipate to have it in the first, hopefully second quarter of this fiscal.
Oh, that's great.
It's very close. Yeah.
Good news. Thank you, Juliana. Back to you, Nicole.
Great, thanks so much, Rosario. So just revisiting the CanPath pilot project that we're doing in those 3 different provinces, we've had to do a bit of gymnastics here with actually making the analysis happen. And so what we're currently doing, largely due to the variation that exists across the provinces that Juliana has mentioned, is that we are doing analysis within the province of Alberta for that part of the study. And that's because Alberta does not currently have a remote access environment, unlike ICES. An ICS analyst is actually doing the analysis for the British Columbia data, and that's accessing the data remotely in Population Data BC's secure research environment. And then, of course, also the analyst at ICS is doing the analysis for the Ontario data. And then once that is all complete, then at ICS, we're doing a meta-analysis for the 3 different provinces with the analytic outputs shared with the PI. On the MultiCentre Trial, so because the aim is to have the data analyzed in a single location, and that's actually here in Ontario, they're really hoping to make full use of the sample size. And so this study isn't pertinent to the study, is not a comparison across different provinces. They really do want to make full use of all of the participants that have currently consented to be part of this study. And then we are also We've also had to work with them on the secondary use piece, and I'll ask Donna to speak to that a little bit because it kind of challenges the existing clinical trial paradigm for making that data available for further research.
Yeah, so just to speak to that, there's a couple elements, and the first, of course, is that making sure that you have the right permissions in place to do the secondary use for the linking and having all the wording. And we've gone back and forth on the consent forms, but also that often for transparency in clinical trials, there's this importance of sharing data and sharing data forward and making it available to other folks. And that just isn't possible under our data sharing agreements. And once the data has been, even though we all have consent to share for this one particular study, that's where the sharing consent, that's where the authority ends. So, and we can't allow it to keep going forward. And this has been a struggle because often folks who access data at the data centers are faced with this when they go to publish, or they're asked to reveal their data sets. And so we're sort of navigating this. How do we make it possible for researchers, to be able to do this? And short of providing phrasing and wording about the, come back to the data centers and, ask for the data here directly, there's not a lot we can do around this. And it is a piece that we are going to have to address. There's a question there. I just want to see, could individual level data from multi-jurisdictions be accessible to research? That's exactly the issue, is we can only make the pooling data is by far the hardest thing. And that's what we're trying to do for this one particular case study, is at the line level, share the data across the borders. So we have to have consent of the participants. And we often have to have, depending on our jurisdiction, some other requirement. So I use New Brunswick as a case study. We need permission of the minister. Then we will pool it to the central location in Ontario, where it will be de-identified and linked for the study. But pooling data is not the ideal. We want to come up with ways to do research in meaningful ways where we can do it across the regions. And that's another whole topic for another day. And so the pooling is by far the exception to the rule. And we really want to make use of DASH and the abilities to do research in our respective regions. And anyway, I'll leave it at that.
And so, Donna, is that where the issue of small cells plays a role vis-a-vis aggregate data and the usability of the different types of data for the research?
Yeah, and so that's exactly it, Rosario. So for this particular case, doing the study in multiple regions and comparing the results, that it's not feasible to the particular population that's involved here. And this is when pooling needs to be considered, is when it's not always going to be the ideal to do it in the respective regions. It's going to be more, I'm missing the language there. The word I'm looking for is comparing the aggregate results. My brain just went. So, but for in this particular case, yes, this way by pooling, we'll have that advantage, and we will the researchers will be able to use the data because of like you said, the safeguards that are in place, like small cell size. Because if we did it in our individual provinces, they just couldn't release the data.
Yes, and the comment says that Stats Canada does this to a limited extent. For example, data NACRA is linked to CCHS for 9 provinces. Do you have any background on this particular example?
On NACRAs?
Or on the example, Donna, Juliana, or Nicole?
I think, maybe I can speak to that, wearing my Kai-Hi hat. So the data NACRA sharing with StatsCan is a long time coming, right? It does involve a lot of pretty complex discussions and agreements, and also an examination of the individual organization's mandate and our agreement with our own data providers. So in the StatsCan perspective, in the Kai-Hi StatsCan linkages, we were able to achieve that, and it's beyond data NACRAs actually. It's beyond the CCHS. There's a couple other StatsCan data sources that are also linked as well. But I think imagine that conversation across 6 or 7 jurisdictions. Just the complexity of it becomes quite a different scenario. But I know the StatsCan Kai-Hi resource is a great resource for us to leverage as well. And we have directed some researchers to them. So.
Would you say as well that as it relates to the data centers, that there's different applications of what is in identifiable data, whereas in certain data centers, they may lean to certain data sets to be more on the de-identified spectrum, and certain data centers would lean towards data being more on, the personally identifiable? Or would you say that across all 13 data centers, there's a good understanding of the data and whether it's identifiable or whether it's quote unquote de-identified?
That's a great question. I would say that there is a common understanding. I think whether we call it de-identified, pseudonymous, masked, like whatever the term, but I think there is a common understanding, because there's very common shared practices for how we safeguard the data when we are linking administrative data sets, and people treat the data the same, with the same respect as if it was identifiable. And I think there is. I think there's. Juliana, did you have anything on that as well?
That's my sense as well. Like I think in our conversations among our data centers, we have a good sense of what it means to be de-identified, right? And the actual approach or handling of data elements might be slightly different, but I think the general understanding what de-identified is common, and it's solid across the country.
So just a follow-up question, and on that, in provinces where there's specific health legislation that may include a defined term for what is de-identified or so forth, and in other provinces where there's not health-specific privacy legislation, have you found there to be a difference in terms of how those data centers work with the data and under the legislative schemes that they reside under? Or
So,
how specific privacy legislation is not really much of a factor in how easy it is to share the data?
Oh, to share the data across borders? That's I don't think it's necessarily the legislation itself. I really think it's the political will. I think it's the appetite to do it. I think there's a risk, and this isn't just this is common elsewhere, globally. Europe is addressing this right now, particularly, and I want to frame this. We're talking about sharing of personal health information and personal information for research. Like
that's
this,
right.
that's the the case here. Very, very common across multiple jurisdictions, struggling with how to do this in a way that is protective of the data, mindful, respectful of research, and at the same time, there's a balance there. There really is a balance. So,
okay. So the fact that there is general privacy legislation or specific health privacy legislation is not really a factor then when it comes to the work that HDR in Canada is doing.
No, but I see a question in the chat,
Yes.
and it's a good question. They're asking about the variances within the provinces, and I think a lot of the variance comes to just how the provinces interpreted the role of the data research centers, how they've understood research, the secondary use for research. Those are all elements that are different depending on the jurisdiction. So, and the information I point to the legislation, it's on the HDR Canada website. We have a comparison. So you can go and look up the word, you could search, it says, it's a table and it has de-identified, and then it'll tell you all the pieces of legislation and if de-identify is defined and where it's defined. So that would be a great place to start, certainly, to find the information.
Great. Any other questions on the case studies? Not at this moment. Okay, so, before we move into further discussion, a question for the three of you. What would you say is next or on the horizon for HDR Canada and the work that you're doing generally? Maybe Donna, will go with you first.
Okay, so, well, I'm excited about the data sharing agreement checklist. And I know that sounds bazaar. But honestly, having to negotiate multiple data sharing agreements and all the fine tuning and requirements, it will be a useful tool. We're also really excited that the privacy team is really excited about putting together guidance for researchers when REB, and privacy compliance need to work together. And it's really important to understand that. And often what happens is one trumps the other, or there's misunderstandings that, well, it's been reviewed by REB, so I'm good to go. But maybe the consent form is missing a key piece around privacy that needs to be shared. So there's a balance there. And I think that guidelines will be a really useful tool. And we'll do the same thing that we did with the consent wording, and we'll workshop it out. We'll share it with anybody who wants to provide feedback. So
That's great. Juliana, how about yourself? What is next from the work that you've been doing?
Sure. So I think from a DASH perspective, of course, like what I mentioned about the common data request form, that's something we really want to kind of achieve in the next couple of months. I think generally it's just to improve the researchers' experience through our DASH services. I think if you remember the flow chart that I presented, we have, I think, starting to have a good understanding and shape of how we can best support people in the intake phase. Now we're going to go into the data access request stage where things are really different locally, and look for opportunities to help align things and make things more efficient as well. And I think the other thing that I think, Donna, you alluded to was, the whole idea of pooling of data versus distributing that analysis. And I think that's a conversation that's actively happening within the network. As Donna suggested, pooling may be kind of the first thing that people go to, but it may not be the best necessarily option or most efficient option. And nowadays we understand that there's a lot of analysis that could be done in a distributed way if we're set up appropriately, if the data centers are appropriately, and we have ways to inform and share with researchers how that can proceed and what that looks like. So I think at the network level, and DASH is supporting that as well, as to think through what that looks like and be able to communicate and articulate those type of options a little better. So hopefully, you'll hear a little bit more about that in the months to come.
Great, and I see a comment in the chat, which is an accurate one. I think in the CanPath case study, we saw that, where it's not necessarily just about different provincial policies necessarily, but it's also, I think, as cybersecurity becomes more forefront, and as the threat risk landscape has evolved and changed over the past 5 years, and we see the cybersecurity threat environment really imposing requirements on institutions, that that these requirements are being talked about and discussed and actually applied, such that if you want to share data with other provincial or data centers, they have to meet a certain threshold as it relates to privacy, as it relates to cybersecurity, as it relates to a myriad of other components. And I think the question in the chat is a real one that happened with respect to cybersecurity certificates. Maybe if somebody wants to speak a little bit more about that at a very high level.
Yeah, I can just add really quickly that absolutely Mahmoud's correct about that. And one of the things that an internal exercise we're doing is to look at our data centers and to say, what are our standards within HDR Canada? And that's going to be our starting point, and then serve as a benchmark to see, can we find standards that we can follow, and just really a starting point for what can we measure ourselves against, and then look at best practices elsewhere, and can we come up with a cohesive, harmonized approach to our secure research environments or our trusted environments for analysis.
Perfect. And what about strategies that gives due consideration for Indigenous data sovereignty while facilitating data access linkage and so forth? If you could give some examples as to how Indigenous data sovereignty is incorporated within the work that HDR Canada does. Maybe
I'll get started. So the Indigenous data work is a separate area. It's a different ongoing, really hot conversation that we're having within the network as well. So as you can imagine, all of our member partner centers, all our data centers do have some existing, policies and thoughts around how to make sure that indigenous sovereignty is respected through their own local access processes and policies. But as a network, we're also trying to think through how do we kind of push that a little bit further to make sure that the indigenous partnerships and also indigenous-led work is being encouraged at our network level. So at the moment, I think it's still kind of work in progress. We're in discussion and having a lot of conversation about it. And we are still looking to respect locally at the local centers policies and procedures right now, but looking to have more developed kind of policies and procedures at a network level in the next little while. But I don't know if others have anything to add.
I could just add on that we're so fortunate to have the Indigenous data sovereignty work be under the leadership of Drs. Jen Walker and Robin Rowe, who are familiar names to the ICS community. And I think that that's just so important to make sure that that work is really truly Indigenous led, and really excited to see the efforts and the partnerships that their team has been building.
Terrific. And another question from the chat. So does HDRN have plans to create a platform to enable sharing of aggregate results with small cells to facilitate that pooled analysis? So back to that one particular, thorny issue that, we need to solve.
Yeah, and I think that goes back to kind of my discussion around options and opportunities for distributed analysis. And this exact scenario is something we just had a recent discussion about. Is there opportunity for us to look at sharing aggregate results, and there are small cell size concerns, but still look at ways for us to facilitate that type of analysis. So I know just a couple of weeks ago, we've had conversation about how to address those kind of privacy issues in those contexts. So it's something we're looking into as well. I don't know, Donna, anything to add on that?
No, I think it's distributed analysis was the word I was looking for earlier, and I couldn't pin it down. But yeah, I think that's really, I want to say it's a discussion for the algorithms and the modeling working groups. Yeah.
Wow, yeah.
Great. And Nicole, we didn't get to you in terms of thinking about the future and what's on the horizon for HDR Canada.
Sure, thanks so much, Rosario. So I would say that actually moving forward on these case studies and seeing them through to fruition is really exciting. And wearing my partnership hat, I think it's important to note that we wouldn't be able to work through these thorny issues if they weren't happening in the context of really, really solid partnerships. I think that one of my colleagues at one of the partners is here today, and having that working relationship where we can really just troubleshoot things and go back and forth on all of the many roadblocks and curves in the road that we have encountered has just been so beneficial, and just will set really strong precedent for how we can be doing this in a, knock on wood, easier way in future partnerships with the lessons that we have learned. And then also, and I can take no credit for this at all, but continuing on with the policy analysis for the clinical trial study. I think that that's been such a fascinating exercise to date, and will continue to be going forward, and really seeing a bit more of inside of the black box. We know through the work that the privacy team has done, a current state of the legislation and the variation that exists across provinces, but what we don't have a fulsome understanding of is that policy piece and how we can enable that data sharing and what some of the roadblocks might be there. So continuing to explore that, I think, is something that will be really exciting going forward, and hopefully benefit researchers more broadly. And again, all in collaboration with my colleagues here today.
So thank you very much, Nicole, Donna, and Juliana. I can certainly say that over the past few years, looking at where HDR Canada was and all the work that has happened to date with the different committees, different partnerships with the different, innovative approaches to data access has been really tremendous. And so I think it's exciting to see what's going to happen over the next few years in a variety of different ways, whether it's, on the collaborations and the partnerships between the data centers, whether it's on Indigenous data sovereignty, whether it is, on moving the needle on some of these privacy issues that maybe are not privacy issues, they're just issues that need to come together, where we need to brainstorm and be a bit more creative as to how we're going to go about it. The interplay between, ethics and privacy and cybersecurity and the regulatory landscape, and also, of course, we're here to enable access to data so that we can conduct really groundbreaking research in Canada. And I think, I think we're getting there. And I think the partnership has been tremendous. So if anybody has any questions, Nicole, Donna, and Juliana, perhaps you can just put your information in the chat. Please feel free to reach out to them. Donna, I see, has also provided a link to an informative newsletter. Please go on the Dash website as well. Oh, sorry, go ahead, Donna.
I was just going to say, I just want to highlight this. This is a newsletter that's put out by the Ideas Group and the Indigenous Data team, and it's really informative, and it speaks to some of the very important considerations around data sovereignty and making sure that we're including everyone in our data research in a respectful way.
Excellent, great. And so please visit the website as well. There's lots of information, especially for some of you who are also in the privacy space, and you want to go take a look at the legislation. Please go do that. It says, how do we access the letter?
Oh, you just sign up for distribution. It's right at the bottom. Subscribe, and it'll be sent right off to you right away.
So team, I think you'll have lots of new subscribers, hopefully, following this workshop. And thank you very much for your time. Enjoy the rest of the research forum, everyone. Thank you very much.